Hello and welcome to the interdisciplinary simulation project that we're going to do for all the Stony Brook interns. And this project is going to touch on crisis resource management. I'm going to explain how we approach crisis resource management, 5 main things for you to remember about it. And then we're going to march you through a pretty simple scenario where we show you first how it's done wrong and then how it's done right. The idea behind this whole interdisciplinary simulation project is not to trick you or to try to come up with something you could never figure out, but to just basically lay out what crisis resource management is all about and have you study it ahead of time by watching this video, reading about it before you come down here, and then coming down and basically just demonstrating to us that you know how to work in an interdisciplinary fashion when there's a crisis. I'm going to tell you exactly what the crisis is right now and tell you how we're going to march through it. We're going to be going to the bedside of a patient. We've hung the wrong unit of blood. The patient is having a transfusion reaction, and surprise, surprise, he rapidly goes downhill. We're going to have interns here from a variety of different specialties, just like you're going to when the big day comes and you come down here and join us. And we're going to use 5 main ideas that tie in with crisis resource management. Now, there's many, many, many ideas with crisis resource management. The list is much longer than 5. But the idea is to have you practice and demonstrate your skill in 5 main ideas. I'd rather have you have 5 ideas that you know well and know how to really work with, rather than 20 or 30 ideas, which you just can't remember when the crisis actually happens. So let's go through what those 5 things are. And to help you get this right, we even put a poster on the wall that has the 5 ideas right there. Recognize this is serious and call for help. Close the loop in communicating. Establish a leader. Use your resources appropriately. And step back and do a global assessment. And if that wasn't enough, I can tell you that I gave you another way to remember. Every one of you got these little cards. Pull them out. Take a look, and during the actual exercise you can look at it and say, okay, recognize this is serious and call for help. Let's close the loop in communicating. Let's establish a leader. Let's use our resources appropriately, and let's step back and do a global assessment. So that's exactly what we're going to do here. There's going to be people from all different specialties: surgery, anesthesia, internal medicine, peds, all different family medicine, and you're going to work together to get through this crisis. It's a known crisis. You know what's coming. The main thing you're going to do is demonstrate that you understand these 5 main ideas. Let me repeat it. You can look at the card. You can look at the poster. Just use these main ideas to get through this crisis. I hope you enjoyed this little learning exercise. I think there's 2 Smiths on the floor. I think this maybe got the wrong. Do you think he maybe got the wrong blood here? He's not. Have you admitted him, right?
I think that was Rebecca.
No, yeah, no, I think he came like in between.
I came
Yeah.
Okay.
I think I started it, but
Who checked this? Because it's got to be
some
checked.
nurses, I
nurse.
think, yeah.
Sure.
Pulse is pretty fast.
I think we have the wrong bag of blood hanging up here.
I think we do. We should
We do?
stop it.
All right.
Stop it.
Stop the blood.
We call for fluids.
We got some
Yes.
fluids. Is this?
You used to his chest and he gave pulmonary.
All right. Is this
edema or
bad enough to
anything?
call for rapid response?
Yeah,
We're
rapid
gonna need some
response.
help. We're gonna need
Rapid
some extra help
response.
here. Okay, I'm getting the rapid response team. So, what's our take-home lesson from this first step in the 5 steps that we're learning of crisis resource management? Let's go ahead and cheat. Recognize this is serious and call for help. If you remember nothing else from crisis resource management, that alone will probably save a patient's life. Something doesn't look right, the vital signs look bad, you're maybe overmatched, maybe you need more serious help in here, maybe you need more senior eyes to look things over. Look, this is serious, call for help. That's the first main idea. Okay, he's going south pretty fast. Get some napkins. Get some napkins.
Should we get help? Maybe we should get help. Who can help?
Who can help?
Does he have a pulse? I don't know.
stop the blood?
I stopped the blood.
Okay, all right. We're gonna need some epi.
Okay, I'm gonna get some epi.
All right. The code team needs to be called. It looks like it's about to crash.
I'll get on it right away.
Okay, we're gonna need extra IV access. This
I'll
guy's-
work on that.
Okay,
Get it,
sounds
get it.
good. Second main idea, and again, I'm cheating. Make sure you close the loop in communicating. You don't just throw out, hey, give epi, get this, get that. You, Dr. Smith, get the defibrillator. You, Tom, get the blood gas results. I need those right away. And then when Tom gets that information, Tom turns back to me and says, got the blood gas, here it is. Or Dr. Jones says, you said get the defibrillator, I'm getting it right now. Don't just throw ideas out there, you want to close the loop in communicating. We need to start chest.
I know, I'm thinking that we need to get a pulse. You know what? I think we need to get the blood. I need to get the
This guy is going south fast here.
Alright, so I'm gonna take over the team leader.
Okay.
I want you to call rapid response. We got an IV, Krista.
Sure.
Dr. Gallagher manage
I'm
the
ready
airway.
for
And
that.
directly start chest compressions.
Yeah, I'll
for
start
us?
chest compressions.
Okay.
Okay.
What's the third main idea? Establish a leader. When everybody's yelling, it tends to happen in an emergency. Everybody's yelling, hey, quick, you know, who's sailing the ship? Who's the captain? Who's flying this plane? If everyone's running around giving orders, then there is no order, there is chaos. So you want to establish a leader. Ideally, this would be the senior most person, the one with the most experience, steps back and says, okay, I'm gonna run this code. Keep in mind with the leader, it's not like the information is the leaders and the leaders alone, but all information comes into the leader and all directives go out from the leader. You want to make sure you're never short-circuiting things. You're never saying, hey, look, I think the tube's in the wrong place. No, you always, hey, leader, I'm telling you, I think the tube's in the wrong place. We need to reassess this. So you want to be sure and establish a leader. The leader gets all the information and the leader gives out the directives. I think this guy might have a pneumothorax.
Oh,
so,
yeah, chest tube or something like that? Or?
Wait, you're with
You know-
family
wait,
medicine.
wait,
Have
do
you
you do
done
chest
family
tubes?
medicine?
I've never
Do you
done
do
it.
chest
I've
tube?
never done it.
Does anyone do chest tube?
Okay.
Anyone do chest
Have you
Yeah,
done
I
the?
think it
Have
goes
you
in
managed
between the
airways
ribs,
before?
right?
Go ahead.
Okay,
All
yeah,
right,
I think
okay.
I think you should.
You're in surgery. I want you to give the chest
Yep,
tube.
not a problem.
You're in anesthesia. I want you managing the airway and stuff. You've done internal medicine and some ICU. Both of you've done some
I can do
ICU.
chest.
I want you guys to run this code, all right?
Sure,
And I'll go
sure.
ahead and start the chest compressions,
All right.
all right?
No,
I'm with
See, a
orthopedics.
chest
I can
tube
push a
for me?
bone down.
Not a problem.
The fourth main idea that you want to know of the 5 ideas that we're emphasizing here for crisis resource management is use your resources appropriately. You have different specialties here. This is an interdisciplinary thing. So you need a chest tube. Who's your best person to do the chest tube? The surgeon. You're from surgery, you do the chest tube. You have an anesthesiologist here. You from anesthesia, you manage the airway. Maybe the internal medicine person has been on the ICU a lot. You from internal medicine, you're a good person to run the whole code. So you want to use your resources appropriately. That's the fourth main idea.
Chest compressions, epi.
We're still asystolic.
Giving epi.
Epi.
I'm giving more epi.
Give another
Epi, more epi.
Alright, give me more
I
Okay.
think we need more epi.
yeah,
Are
more
you
epi.
tired or are you good? Okay, who's got the airway? You have the
I got the
airway,
airway.
chest compressions. Have we given epi? How many epis have we given?
Giving one epi so
Give them
far.
one. Okay, let's step back. Let's look at the rhythm. Let's everybody look at the rhythm. Let's see what we got
It's still
here.
asystole.
We have it's systole. Okay, so it's not a shockable rhythm, right? Not a shockable rhythm, right? Continue CPR. Good. Let's continue bagging.
6 H's and 5 T's. Should we go down
Yes,
that maybe?
we should go down 6 H's, 5 T's. Anybody know any history on this guy? What happened? How did this happen?
Wait a minute, he's renal failure. I mean, I'm thinking he missed dialysis.
That's a good thought. That's a good thought. When's the last time you got dialysis? Check the chart when you got
I'll check the
dialysis
chart right away.
last. All right.
The fifth main idea, the final idea of crisis resource management is you need to periodically step back and do a global assessment. Especially the leader, if you're in too close, you're seeing the trees, you're not really seeing the forest. You have to step back and periodically reassess everything and say, Okay, let me see here. This code's not going so well. Has anyone got an idea? Let's think about this. Let's go over the ABCs again. Let's do the 6 H's and 5 T's again. So you periodically need to step away from what you're doing and think everything over one last time. And that's the fifth and main idea that you want to take away in this section of crisis resource management. Step back and do a global assessment. And that's it. I hope you enjoyed this little exercise in crisis resource management. What we did was hammer home the main points over and over and over again. Again, you can cheat. You want to recognize this is serious and call for help, close the loop communicating, establish a leader, use your resources appropriately, step back and do a global assessment. I hope that by watching this video, maybe watch it a couple times, and by reading about crisis resource management, when you come down here with your fellow interns and you do this exercise in crisis resource management, you'll be able to demonstrate that you can handle a crisis, you can work between disciplines and get this patient through the crisis. From the Stony Brook Simulation Center, thanks.